Welcome. We're so excited to have you joining us today for our community discussions on telehealth and newborn screening during the COVID-19 pandemic. My name is Mariana Rea, and I'm the Associate Director of Programs at Expecting Health, and I am thrilled to be hosting and helping facilitate this very important discussion today. We certainly appreciate that the last 10 months and beyond have been challenging, to say the least. And so we are so excited to have an opportunity to convene this really great and diverse group of stakeholders from the newborn screening community and really dig into some important discussions to better understand and develop strategies on how the newborn screening community and telehealth specifically have been impacted during the COVID-19 pandemic. A few logistics before we get started. We have a great lineup for you today, and this event will consist of a brief presentation from our wonderful partner and colleague, Christen Crews from the Virginia Department of Newborn Screening, followed by some in-depth group discussions via Zoom breakout rooms. And then we'll be coming back together as a large group to share the key takeaways from those discussion groups and really to listen and learn from one another. This session is being recorded, and a link will be made available online through our Expecting Health YouTube channel following this webinar. And of note, while this session is being recorded and the small group discussions will also be recorded, we will only be posting the general group discussion on the YouTube channel. And of course, we welcome questions and comments. We realize there will be some technical questions perhaps during this session. So if you do have any questions along the way, please be sure to post those in the chat box. And we do have team members that are watching that throughout, and we'll be able to answer or address any questions that you might have technically, as well as comments or questions at the end of this session. And of course, we'd like to start by first thanking our partners at the Health Resources and Service Administration, or HRSA, who have supported through grant funding of $500,000 annually the work of the Newborn Screening Family Education Program. It certainly would not be possible without this great support and partnership through HRSA to deliver and create opportunities like this to convene and bring together important stakeholders from this community. So thank you. We recognize that while many of you may be familiar with Expecting Health already, that there may be some new folks in the audience listening in. And again, we are grateful that you're here and thank you for joining us. Just a little bit more about who Expecting Health is, in case you're not familiar. Expecting Health is a team of key leaders in health communication, pregnancy, and pediatric health who really aim to bridge actionable information with the everyday realities of women's experiences and family lives. And really how we do that is exactly in this manner. We convene and bring together key stakeholders from the communities that we serve, including our very important families, our federal partners, our advocacy partners, our state screening partners, and all of the various different stakeholders that are involved. We do that through the development of training, and it's important that we think about how to create training experiences that are unique and innovative for our families. Specifically with the Newborn Screening Family Education Program, this is one of the programs that Expecting Health supports. And really the goal of this program is to create a newborn screening training program for families that helps them build the confidence to become advocates for their family's healthcare needs, to become leaders within the newborn screening community, and really to help generate those leaders within that system. And we truly have a vision that through this program, we can create a landscape where all families have equitable access to newborn screening education. Navigate Newborn Screening is a specific newborn screening curriculum that's been developed through the Newborn Screening Family Education Program. It is a free learning opportunity that is available to families and healthcare providers through the website that you see here, and we will also be posting that in the chat box for your interest if you have not already seen that. It's through this curriculum that we have developed specific modules that help expecting parents learn more about sharing their story and becoming advocates within the newborn screening space. And it really is a wonderful curriculum that we've put together that helps provide education and training for newborn screening. So for our objectives today, we're really excited to have this discussion with all of you. And really what we're looking to do is listen and learn from all of our lived experiences. We certainly, again, know that COVID has impacted the way that we have to do things within the newborn screening community. We want to seek to understand how those impacts have been managed through this process. And the way in which we're going to do that is to first seek to understand the different ways that telehealth is being used in the newborn screening community, specifically around follow-up with families and regarding education that's being delivered. We want to learn and understand what the benefits and barriers are to all of you through this pandemic, and specifically as they relate to telehealth. And really, and certainly most importantly, we want to think about what strategies we can develop to help improve the telehealth delivery and to have positive impacts on the families that we serve. So in terms of lineup and what to expect for the next hour, we're very grateful to have the wonderful Christen Crews joining us today to share a bit more about their perspectives and their experience with telehealth during the COVID pandemic in Virginia. And I'll introduce Christen in just a moment. Following Christen's brief presentation, we're also, as I mentioned earlier, going to have a small group breakout session for approximately 30 minutes. And following that, we're going to come back together as a larger group and share the key takeaways that have been identified through those small group discussions. We'd like to leave a little bit time at the end for question and answer. And then following this, again, we will provide a recording on our YouTube channel. So with that, I'm thrilled to announce and introduce our speaker, Ms. Christen Crews. Christen is a public health nurse supervisor for the Virginia newborn screening program. She's been in this role for almost 5 years and previously served as the blood disorders coordinator for the Commonwealth and led the implementation of CCHD screening. She certainly has a passion for education and process improvements that have positively changed the outcomes for the program and families in Virginia. And we're really excited to have her here today to share a little bit more about her telehealth experience. So with that, Christen, I'll turn it over to you.
Great. Thank you so much for that introduction and welcome everyone. So I'm just going to take a few minutes and just briefly share Virginia's experience. Now I know that challenges that we've experienced in Virginia over the past 10 months are not unique to Virginia. These are challenges that are echoed across the country and across the world. However, we wanted to highlight what our experiences were to share, and then as we move into our breakout discussions, discuss other experiences and solutions or what could be done better in the community. Next slide, please. So I'd like to start off and just provide a quick overview of what newborn screening looks like in Virginia. We have 100,000 births in Virginia each year. Next. And approximately 20,000 infants need follow-up services each year. And we have about 3,000 clinically diagnosed infants every year in Virginia. In Virginia, this is similar algorithm that's seen across the country, but from when a baby's born to when the results are received the provider, we have a goal turnaround time of 4 days for time-sensitive critical results and all normal results within the first week of life. Next slide. But what I wanted to really highlight or spend a couple of minutes talking about is the life cycle of the newborn screen, because the newborn screen is so much more than just collecting the newborn screen in the hospital or by a midwife and at a hospital setting. The newborn screen has so many different stakeholders involved, from the birthing facility to the laboratory to the follow-up team to the pediatrician, and as well as the family. So all these different steps in the life cycle of the newborn screen are key to having a successful completion of the newborn screen, timely reporting of results and follow-up. Next slide, please. So first, I just wanted to talk about the evolution of telemedicine to telehealth, because this has changed a lot in the last 10 months as a result of the COVID-19 pandemic. So historically, when we think of telemedicine, we think of remote clinical services. So you talk to your doctor on the phone, or or an app. There are various apps that you can have like a urgent care visit that they have available now. But in the last 10 months, standard of care has needed to evolve. And this is what we've seen in Virginia with moving more towards telehealth and the expansion of healthcare services. So the Health Resources Service Administration actually defines telehealth as the use of electronic information and telecommunication technologies to support long-distance clinical health care, as well as patient and professional health education, public health, and health administration. So it's beyond just the narrow focus of remote clinical services that are identified with the telemedicine. And then technologies can include video conferencing, apps on your phone, internet, streaming video, wireless communications. So there are a lot of different technologies available. Next slide. I just wanted to share with specifically in Virginia, I surveyed our genetic referral centers on how telehealth has changed in the last year as a result of the COVID-19 pandemic. And I received a total of 7 responses from different geographical regions of the state. So in Virginia, we have a variety of geographic distribution. We have cities, we have urban areas, suburban areas, we have rural, and then we have really remote areas as well, where some accessibility to care is really at a disadvantage. And then, so our objective with the survey was to determine if telehealth and newborn screening has changed in the last year as a result of the pandemic. And I have some data to share with you. So prior to COVID-19, we're using telehealth as a standard of care for newborn screening. And only 70% of our referral centers stated that they were not using telehealth as a standard of care. If we go to our next survey question, for the ones that were using telehealth, which we had 2 answers for that, they were using them both for critical newborn screening results consultation, as well as for follow-up newborn screening phone consultations. So this could be for presumptive positive results, speaking with a provider or the family, especially if it's on the weekend, or for follow-up if laboratory results have come in, like diagnostic results have come in, as far as advising them of next steps. And this was seen more frequently in the more remote and rural parts of the state where there isn't access, easy access to a specialist. Next slide. When asked about what technology was used, phone was the only technology that was used prior to COVID-19. Next slide. So when we questioned about the frequency, we had 0 to 1 was the majority of the answers, and then we had one provider said about 6 to 10 telehealth sessions per week. Next slide. So then comparing to now, so when we're in the pandemic or during the peak, so we asked if they use telehealth as a standard of care. 100% of our centers are using telehealth as a standard of care, where prior to the pandemic, only 30% were using it. And another huge change that we saw, we asked if they were using telehealth, what types of services, and 100% are using it for clinic visits, where prior, no one was using telehealth for clinic visits. So telehealth for clinic visits is now occurring. And we also had more providers saying that they were using it for consultations as well. Technology also saw a huge transformation. We went from only the phone to a phone and video platforms or video platform. So there was an expansion of technology as well. And then the frequency of telehealth sessions per week. So we still had some fewer occasional, not quite as frequent occurrences. The most common was about about 2 to 5, and then we did have one higher of 11 to 19, and this may be related to our western part of our state, where it can be more remote and rural and has less access to care. So that was some interesting data that was beneficial for our program to gather, for the purpose of this webinar, and it's a good takeaway as far as the evolution that we've seen. I did also just want to talk about a couple of programmatic changes affecting telehealth, because as I mentioned, where telemedicine was just focusing on remote clinical care, telehealth expands that to education. And so newborn screening education is important, not only for the families and providers, but also for hospitals. So something that most newborn screening programs do is they will do site visits or go visit hospitals, provide educational updates. However, hospitals don't really necessarily want outsiders coming in at this time, yet education still needs to continue. So in Virginia, what we did was we converted to virtual education by utilizing a virtual platform that also has the ability to poll and survey attendees. Staff can attend from home, so you have a higher attendance rate. You're also able to record sessions for future use by the hospital or facility. So the feedback that we received from the hospital was great. The nurses learned a lot. They can have a recording for orienting or onboarding new staff. As far as programmatic benefits, we have the potential to provide more education without travel time and cost, because let's say it could take us 6 hours to drive to one of our hospitals. It's like the furthest remote point. And so that's like a 2-day trip to go and see this hospital. You're able to have more presenters and experts, so with less time tied up. And then we also provided education to approximately 80 nurses or staff members over only 2 sessions, where typically with an on-site site visit, we only maybe have had 10 to 15 in a room. So it was a much larger group. Next slide. So some best practices that we would recommend for successful virtual engagement is to do a practice room facility prior to the first session to test platform compatibility, because different hospitals will have different sites locked down, and expand the participation, offer a link for staff at home so they can log in from home, offer multiple sessions, and try to coordinate with the staff meetings. And staff meetings are typically mandatory, so you'll have a higher attendance rate. And be flexible as far as offering it both for the day shift and the night shift, and include both your well baby mother-infant units as well as your NICU. Allow question and answers to encourage engagement, and you likely will hear some interesting questions. And record the session, and then engage the hospital with data specific to them and present a case study. I hope that was just a helpful brief overview as far as what Virginia has been doing with telehealth. And now I'd like to transition it over to Brianne, who will advise us of our next steps.
Great, thank you so much, Kristen. That was wonderful. Now for the next portion of this webinar, we will transition to our breakout rooms. As you may have noticed on our registration form, we asked you to rank which of the 4 breakout rooms you'd like to participate in. So now we will, just to be conscious of time, we'll do 25 minutes in the breakout rooms. So everyone has been pre-entered to one of these 4 breakout rooms: technical aspects of telehealth, telehealth appointment preparation, the personal connection, or quality of care. So we'll break up into those groups. Next slide. During the breakout rooms, we will discuss these 4 key questions. We're really excited for this opportunity to hear from everyone about how telehealth has impacted their experience with newborn screening since the COVID-19 pandemic. We do ask that if anyone is willing to pick a spokesperson per each breakout room, so when we come back to the main room at the end of the breakout rooms, we can hear from each room what they discussed, their key takeaways. So here are the facilitators. Anyone in room 1 talking about technical aspects will get to spend some time with Kristen. Room 2 is with Natasha. Room 3 will be Jamie and I, and room 4 will be Mariana. So we can go ahead and move to those rooms now. If you have any technical difficulties, please send me a message in the chat or any of the facilitators, and we will work to address that as quickly as possible. So I'm going to go ahead and start the breakout rooms now. Fingers crossed that this works. welcome back to the main room. We'll just take a few seconds and let everyone join us back here, and then I will let Mariana take over for our wrap up.
Fantastic. Yes, thank you all. Definitely, I hope you enjoyed some good discussion. I know we did in our room, and got some just great validation of some things that are kind of have been identified within the community. So to wrap up, we're just going to take 1 to 2 minutes per room to share what your key takeaways were in terms of benefits, barriers, and strategies. So we'll start with room 1, and Christen, I'm not sure if that's going to be you or someone else, but if you wouldn't mind sharing what your discussion centered around and what your key takeaways are.
So Allison actually volunteered to report out for room 1, so I will defer to her.
Yeah, so Christen led a good discussion. We certainly talked about those big 4 key questions that you posed at the beginning. I think some of the ones that came out of it is just the creative solutions that we've seen newborn screening programs come up with over time, and it seems to be changing daily, but we've been impressed by that. And then, so in terms of what we're also seeing is some, depending on what the baby needs to be followed up with, either offering the telehealth option if it's available, or coming up with other types of hybrid solutions. One of our members in our group was talking about some services have to happen in person, and how people have made that happen. So she was talking about like mobile phlebotomists, which I've never heard before, where the phlebotomist will actually travel to the family's home, which is a really big deal. I was bringing up that I work with newborn hearing screening programs, and because of the equipment needed to do follow-up screening and diagnostic audiology, you have to have equipment that's not super mobile, but there's been some creative solutions in terms of making it so the families don't have to travel as far, so providing equipment to local health departments or local early intervention centers, or different places that are at least closer for the family. And then some of the other ones were or in terms of challenges that we've seen too, is reassignment of programmatic staff. So that's definitely delayed some of the newborn screening follow-up, as staff has been pulled away to COVID, like contact tracing and different things like that. And then in terms of actual telehealth that we've seen just really take off is a lot of the family support piece, as well as the early intervention piece. So we talked about all sorts of different things.
Fantastic. Yeah, it sounds like a great discussion. Thank you for sharing that. Even in our room, I think the technical aspects of telehealth impact quality of care. So it's certainly an important discussion topic. We'll move to room 2. I believe that was Natasha talking about the preparation of telehealth and how that's been impacted.
Hi, thank you. We did have someone volunteer, Beth, but I was a bad facilitator and did not keep check on time. So we ran out before we regrouped. So instead of throwing this to her, I will just follow the notes that I took. So sorry about that. But we kind of talked about both benefits and then issues specific to preparation and barriers. So the benefits really were that for the families, there was just more accessibility to families and not needing to travel. And this was the case, especially for people who are in rural areas. So we had someone who was part of our group who works in Alaska and talked about all of the issues there during typical times, let alone during COVID, in terms of how difficult it is to travel, especially when from the more rural areas, especially in the winter when there really isn't a way to get out unless that's by flying. That telehealth has really helped to reach those families. With particularly around quarantine. There are some of the tribal groups who had very strict quarantine requirements. So the idea of a family leaving and then not being able to come back for an extended amount of time definitely caused some concern that telehealth was able to alleviate, because people didn't have to leave their communities, and so they didn't have to think about quarantining and either to leave or to come back. And all of that kind of is addressing some of the issues around equity, and that even seeing some improvements in health equity, because instead of having to think about getting on a plane to fly out to get care, that care was being brought to them through telehealth. So that's been really great. And especially the issue of when they were at the peak of COVID, there being curfews and things like that. Instead of thinking about, okay, how are we going to travel to this location, get the information we need, and then travel back home all within the curfew, telehealth really alleviated that. And then more specifically for preparation, many of the groups saw families being able to use the platform now that almost everyone's an expert in Zoom, that it's a lot easier now since there's been more experience with that. Many of the people who were on our group talked about how they can follow up with families and really speak with them before they talk to the specialist to say, here are some key questions to ask. Here's some information you may want to get a deeper dive on, so that was helpful. And then for providers, over the phone, for groups that usually had reached out to families via phone, you couldn't really see the obviously hear the nonverbal cues. So it was unclear if people were necessarily understanding, but with video, you can kind of see that. And I believe Joanna has shared a link to a tool that she's used. That's a health literacy tool, but that is called Ask Me 3. That is a really good way to help see if a family is understanding, what's happening in the conversation and key takeaways. And lastly, though, there are, of course, still barriers in terms of internet access. Not everyone has access, not everyone has steady access, and what that means. And then also just the literacy around how to set up in a 20-minute call. Sometimes people spent 5 minutes trying to arrange the video and get in sight and all of that. So that was a barrier in terms of losing time to some of the content. And then, truly lastly, there's so much time spent talking about, oh, we can do all this on telehealth and we need to do this through telehealth. Don't come in, don't come in, don't come in. But then you still need confirmatory testing. So then it's like, actually come in. So that can seem like double messaging, but I will stop there.
Awesome. Lots of great things in there to unpack. So thank you for that. For the sake of time, we'll just move. I hope that you all can stay just a few minutes extra so that we can hear from the remaining rooms, but certainly understand those that may have to drop off. So room 3, the personal connection, Jamie or Brian, do you have a volunteer that's going to share some takeaways?
Hi, yeah, I'm the volunteer, so I'll be sharing some key takeaways from our wonderful group discussion, really trying to focus on the personal connection with telehealth. And to echo what has already been said, some of these benefits has been that they've been able to see providers sooner. It's just been easier to just hop on a call if they have a quick question, or if they also feel more comfortable using a lot of the online health portals to just message their provider. And with every benefit, there's often barriers. Like people mentioned, the use of technology was kind of stressful and created kind of what Natasha mentioned, how the first 5 minutes of your appointment is figuring out the tech, kind of adding an added pressure that you have to fit in all your questions and you have to ask all the right questions, and that you are almost feeling as if you're doing something wrong because you can't get the technology and wasting your provider's time. So that added pressure to be on it and to have everything figured out was mentioned as a barrier. And some strategies that we discussed to kind of alleviate these barriers is to have almost a pre and post call with either someone at the front desk or a nurse or a community health worker to really walk you through what to expect from your telehealth call, to make sure that you have all of the technology set up and ready for your telehealth call. And that is seen as both being kind of like a bi-directional communication. While the provider's office is preparing you, you're also preparing your provider's office by saying, I'm going to have these questions, so your provider can adjust if they need to speak to you for a longer period of time. So really kind of establishing that relationship prior to the telehealth call. And then when you have your appointment, it'll hopefully all run smoothly. And kind of similarly, having a follow-up post call to see how did your experience go, and to really have that platform to share some of the challenges you may have faced. So for your next appointment, hopefully those challenges will be addressed. So really kind of creating a whole multi-step approach to an appointment to ensure that the families are getting all of their needs addressed. And yeah, I know we're at time, and I hopefully didn't take up too much of everyone's time, but we had a great discussion and really appreciate all of the families' feedbacks.
Fantastic. Thanks, Jamie. Rosani, you want to summarize for quality of care, which I think is a great way to wrap up. It encompasses a lot of, I think, what we heard from the takeaways in the other rooms.
Yes, our group discussion was about quality of care, and we start our group on discussing how we define quality of care. And we think that it should be family-centered, and that families should be part of the group, of the team, that feel a connection with a provider. And we talk about some barriers. I mean, the technical access can limit the time for the appointment, lack of knowledge of many of the families that they're going through technology issues, interpretation services. But some of the benefits that we find out, I mean, it was just the convenience of not leaving the house, not being exposed, travel time, just time when we are so many parents working from home, so you don't have to really take off to do your appointment. And some of the strategies, I mean, I couldn't write many details of what we were discussing, but just building the trust between the provider and the family is one of the biggest factors that we discuss in our group. Also, just preparing yourself before the appointment could help the families to have a bit better experience. And also practice the technology piece beforehand. That will also help them to have a better and a quality appointment. I don't know if I missed something else.
Great. No, thank you. And thank you for doing that.
Yeah, of course.
This is extremely helpful and wonderful. And we just are so thankful that everybody was willing to share their perspectives. I know we're past time, so before everybody jumps off, I did just want to let everybody know that we would love your feedback on the format specifically of this discussion. And so we will be posting a quick poll at the end of this webinar. So please don't exit. We'd love to get your feedback. But just to wrap up and kind of summarize, I also did want to make everybody aware of some additional resources from various different partners that we work with and work closely with. So Family Voices has just launched a recent curriculum on telehealth and how to really drive family-centered experiences around telehealth. So if that's something you're not aware of or familiar with, please feel free to check it out there. And then additionally, New Steps, our partners at the National Coordinating Center and AMCHIP also have a multitude of telehealth resources, both for families and clinicians. So please be sure to check those out if you would like additional resources as well. And I know we don't have time for questions today. I think we got a lot of those questions answered in the small group. So again, just want to thank you all so much for your attendance, for your participation, for your willingness to share your experiences. And we appreciate it very much. So with that, we will wrap up. Please be sure to share your feedback with us. And yeah, thank you and have a wonderful afternoon.